Um, Ladies and gentlemen, members of the T20 community, colleagues and friends, good morning to those who are attending from the West, and good afternoon to our guests from the East. My name is Fahad Alturki. I'm the chair of the T20 Saudi Arabia. Uh, may I ask everybody to mute their mics because there is an echo? Thank you, everybody. I have the privilege of moderating this virtual panel on a very timely and relevant topic that is of concern for all of us, the COVID-19 pandemic and its implications on our life. The title of this panel is going to be "How do we win the fight against this deadly virus, and how do we restart the economy?" I would like to first thank our co-hosts, the Saudi National Development Program, and especially my dear friend Abdullah Rakhis, and also our colleagues in the Boston Consulting Group for their kind help and support on bringing together this webinar. Before I give the mic to our speakers for the day, I would like to emphasize the role of the T20 Saudi Arabia in leading the think tank community in contributing and drafting policy recommendations within the G20 process. As you know, the T20 Saudi Arabia is co-led by two of the kingdom's leading think tanks, KAPSARC and KFCRIS. It is also supported by several Saudi and international university, research centers, and also think tanks from around the globe, many of whom are participating in this webinar today. In particular, our community spans or includes more than 1,500 researchers and experts representing around 70 or more than 150 think tanks around the globe, coming from around 70 countries. It's a very proud and diverse community, and we're working together to tighten and to fine-tune recommendations that will serve our global economy and global community. Consistent with the tradition established by past T20 presidencies, we are committed to bringing evidence-based policy recommendations to the attention of the G20 leaders on a timely and relevant issues, not only related to G20 countries, but also for other non-G20 countries. Our response to the crisis triggered by the ongoing pandemic was by creating a special task force that will investigate the impact of COVID-19. I would like to take this opportunity to thank the think tank community for their overwhelming response for our special call of policy briefs, which we announced it at the end of March, and within 2 weeks we have received an overwhelming response. In particular, we received about 65 policy briefs by that time. We are now working on consolidating them, and most of them, the topics that are covered, are of importance to all of us. Discusses the social, economic, financial, and environmental impact of the pandemic, and the role of multilateral institutions and global policies in addressing the challenges presented by COVID-19. This webinar is a very important milestone to the official launch of the Special Task Force, our 11th task force. We were planning to launch the task force on May 5th. So in 2 weeks, we will be announcing more information about the task force, including announcing the chair, the co-chairs, the concept note, and the priorities under this task force on COVID-19. So I will also invite you to participate in the discussion today, and also when we launch the task force on May 5th. We have a short period of time for today's panel, only 1 hour, so we're going to break this into 3 main sections. First, we will start with an opening remark by Dr. Nahar Alazmi, the General Secretary of the Saudi Health Council, and then followed by a presentation by Yvonne from as a Managing Director and Senior Partner at BCG, then followed by Alexander Tuerpitz, Managing Director and Senior Partner at BCG as well. And then we will reserve the last 20 to 15 minutes for open discussion and Q&A. Dr. Nahar, over to you. Can you please unmute your mic and open this panel?
Sure. Thank you very much, Dr. Fahad. In fact, it is really a great pleasure to participate in this very important webinar. So I thank you in the T20 Saudi Arabia and the Saudi National Development Program, Mr. Abdullah Rakhis, and BCG for giving us this opportunity to share the Kingdom of Saudi Arabia experience in limiting COVID-19 pandemic. I hope the voice is okay.
Yes, it's very good.
Yeah. So I'll just start on behalf of His Excellency Dr. Tawfiq al-Rabi'a, the Minister of Health and the Chairman of the Saudi Health Council, and the members of the Saudi Health Council leaders who are the leaders of the healthcare sectors in Saudi Arabia. We want all to express our appreciation to you all for the invitation and also for the participants who are attending this important webinar. And as we are participating in just to exchange the ideas and share the knowledge about the best practice in controlling this pandemic and this challenge, which is facing the whole, I would say, humanity, and its impact on all aspects of life, not only the healthcare systems, but also challenge to the economy and to the social life of the population. I'll just start from where we are in Saudi Arabia. As up to yesterday, we have 12,772 confirmed cases, including 10,846 active cases. 82 are in critical conditions and receiving care in the healthcare institutions. So far, we had 114 total deaths and 1,812 recoveries. As we are approaching and welcoming the holy month of Ramadan, we are following strict, measures and assuring that everybody will keep the social distancing and avoid all the shaking hands and emphasize on washing hands regularly. Currently, more than 150 teams in the field around the kingdom have conducted the mass surveillance for more than 500,000 population. And so far, we conducted more than 200,000 PCR tests. We are facing this pandemic that is a threat affecting our nations at all levels, not only in the G20, but also the whole world. We in the Kingdom of Saudi Arabia understand the pivotal role we play both as leaders of G20 presidency and having the unique experience of containing the MERS-CoV virus, which began in 2012. It is very important to have a sustainable, person-centered healthcare system in place in order to be able to manage an outbreak such as this effectively. We in the Kingdom take it upon ourselves to create a platform that enables all the G20 members to share experiences and to derive initiatives that will assist in tackling COVID-19 and eliminating its burdens on all sectors. Building on our successful experience of some G20 members and in compliance with the international health regulations, the Kingdom implemented a series of proactive measures in an effort to contain the spread of this virus. Our leadership as King Salman and Crown Prince Mohammed has been heavily engaged in prioritizing the health security agenda through the establishment of a high-level multi-sectorial committee headed by the Minister of Health to design and enact the pandemic containment and mitigation efforts. Some of the prominent decisions implemented that have been built on successful measures taken by the G20 members include limiting the importation of the disease through incremental travel restrictions and strict quarantine of travelers arriving from the affected areas, which started early, even before registering a first case in the country. Also launching a nationwide test and isolate policy. A network of sophisticated laboratories around the Kingdom were set to test for the virus. Thousands of isolation rooms and intensive care beds and ventilators were made ready to handle influx of suspected cases as they appear. Monitoring and replenishing national stockpiles of protective equipment, medications, and diagnostic tests. Prohibition of high-risk gatherings, including social, cultural events, and even more importantly, the unprecedented suspension of holy sites visits. As you know, Saudi Arabia hosts Mecca and Medina, where the Umrah and the pilgrims come from all over the world for religious activities, and also enhancement of social distancing through various measures, including suspension of various governmental and private sector activities, mosque-based prayers, school closure, and limitation of movement between regions and cities, and enabling the workforce and educational system to work remotely. And finally, selected curfew and incremental regional and city restrictions, which include our capital city, Riyadh. The Ministry of Health and all the healthcare sectors have also increased the public awareness regarding preventative measures by launching many campaigns that cater to all audiences and have promoted its digital platform in an effort to safeguard the healthcare workers and the users alike. Virtual care has been effective and heavily relied upon in providing self-assessment tools with artificial intelligence components that assist in identifying the onset of any symptoms and directing individuals to the most appropriate facility that will manage their care. Of course, the global support has been integral in the decisions taken and has provided insight regarding the necessary measures to be implemented. Our national centers such as the Saudi CDC, the Saudi Center for Disease Control, and the Global Mass Gathering Center, which is a World Health Organization collaboration center, has offered a global insight to validate the decisions in place. Finally, I just want to again thank T20 Saudi Arabia and the Saudi National Development Program and the Boston Consulting Group for hosting this webinar, and also thank all the participants attending this webinar, and wish you all a very successful, informative meeting. Thank you.
Thank you, Dr. Nahar, for this valuable information and update on the action taken by the Saudi government as well as in the international collaboration and cooperation. In fact, in the absence of such information, we tend to lead toward worse scenario. So your remark on being proactive and the level of transparency on the actions taken by either the Saudi government, which is also mirrored by many other countries during this pandemic, will help all of us as a community to achieve clarity on what is known versus what is speculated or even exaggerated. So we appreciate the quick update. As an observer, the accomplishment of the Ministry of Health and other related entities within the kingdom have achieved this objective. The challenge now is how to maintain the momentum and also have an exit strategy to restart the economy. For that, I would like to turn to Yvonne and Alexander for a quick presentation on how to restart the economy.
Thank you, Excellency. It's a pleasure and an honor to discuss this important topic with all of you today. Maybe let me quickly introduce myself and the colleagues who are on the panel for today's discussion. If you flip to the next page. So my name is Alexander Tuerpitz. I'm a managing director and senior partner in BCG. And I'm heavily involved with several governments right now in fighting the corona crisis and in managing the restart and the rebounds of activities, and we'll come to that later. With me on the panel today is Mr. Vincent Chin, who is leading our global public sector practice, and Ms. Yvonne Zhou from our office in China, who will share with us first hands-on experience from China and how China, which is already further down the road than many other countries, is managing the restart. We go to the next page, and as most countries have successfully managed to flatten the curve, how we call it, and to manage the peak already, and is now approaching the restart phase. There are also new questions coming up, right? It's questions about how governments should look at the crisis and what they can do in order to get not only to survive this and get out of it, but also to get strengthened out of it and make it a success story to get out of this crisis. But also, what is the more operational questions? What is actually the right time to open? How much capacity do we need for testing? How do we do tracing? What is the right balance between the healthcare objectives of containment and other objectives like socioeconomic recovery? And what is the right sequence to do the opening? That are questions we will touch on today. Before we go into the more tangible restart actions that governments have to undertake, I would like to ask Vincent to share with us his perspective and our view as BCG on the key perspectives that governments should apply in this situation right now.
Thank you, Alex, and it's an honor and privilege to be with all of you. If you can move to the next slide.
I think we can jump over this. We come back to that later on.
Sure.
Go one more.
We believe that government should now be thinking about restart of their countries and the economy. But let me first make a very important point that it is important before any country starts to plan to restart that they respond comprehensively first and foremost to the health crisis. If we do a premature restart, you risk infecting the nation with second, third waves of outbreak. We have seen this now happening in some cities. I think Hokkaido, just after they opened, they had to close down again. And Singapore, whose immediate response was very much lauded by all of the world. In fact, Harvard called it the gold standard. You probably heard that just yesterday, the Singapore government extended and made its lockdown more severe up to June the 1st because they had wigglings of infection in their country. And this was in particular the dormitory where they house their foreign workers. And you know, foreign workers live in a hostel-like environment, 25 to a room. When one of them get infected, the whole room got infected. So in every country, there are wigglings, and it's important that we first and foremost make sure that the crisis is comprehensively responded to. and then we start to restart the country. And in our work, in thinking through this, now we've got over 100 projects in 35 countries around the world. We find that governments are not just thinking about restart, but they think about all 3 R's simultaneously, because this is a long-term game. So you need to think about how you reopen your economy, and Yvonne will give you a very good example of how China has done that. But at the same time, the more far-sighted governments are already thinking of how to make sure that the economy rebounds, not just in the short term, which is about quickly restoring confidence to small businesses especially, but also to get into medium-term growth, recognizing the need for priorities for sectors and ensuring sustainable, equitable growth. Governments have poured in significant amount of money into stimulating the economy. Some countries are spending up to and above 20% of GDP, right? And that is larger than any annual government budget. So they're spending double what their budget is. But it is very important that they get the right returns on this stimulus package and not be throwing good money after bad. So again, careful governments are thinking through this. But the most important point is actually at the bottom. This is the best time for governments to reimagine their future now. Why? Because for the first time, many governments that have been operating in silos are operating together, collaboratively, whole of government, and quickly deciding and deploying actions on the ground. I would opine that governments should not dismantle this structure and use these agile squads that they have set up to solve other long-standing issues of government services delivery in their country, be it on road accidents, be it on education quality. This is the time to really grab the bull by the horn and resolve that. And longer term, the crisis have also revealed that there are government shortcomings and there are acceleration of reforms that need to be done. And again, the far-sighted governments will do this. So these 3 R's are what we are recommending to governments to do, to think about as they think about moving now into the phase beyond flattening the curve to fighting and winning the war. Now, if you go to the next slide, I thought I'd just leave you with a few thoughts because there are a lot of words and questions on this slide. The 3 R's, if I were to just simply summarize that, have a restart strategy, but be careful about making sure you understand all scenarios. You may have to tighten up again after you open up, but make sure you meet the preconditions for restarting. Prepare for the rebound, but don't just think about short-term growth, but also medium-term growth, and make sure you get returns, not returns on investment the way private sector looks at it, but return on country. So it is not just a matter of wealth, but a matter of well-being. And I think I am speaking to a crowd that understands this notion, that it's not just about wealth, but well-being, a returns to country concept. And finally, use this opportunity to reimagine government of the future now. Back to you, Yvonne.
Vincent.
Thank you, Vincent.
Hello, everyone.
Yvonne, just give us a second. If you can quickly go back to page 3. Yeah. So thank you, Vincent, for this perspective on the 3 R's, restart, rebound, and reimagine government. When we think about this immediate step now, and all 3 have to start in parallel, but the thing that is shortest term is now the restart. And we have all witnessed governments around the world taking very decisive action to, as I said before, to flatten the curve. And now many economies are approaching or are already in the restart phase. And what is interesting to note is that the restart phase happens very different from the lockdown sequence. So in the lockdown, when the measures were introduced, many of the measures were introduced simultaneously, more or less in the entire countries. They were quite often preemptive because no one knew what are the weak links that Vincent referred to before as well. So entire sectors, entire regions were locked down. And they were, in general, they were generic within a sector. So they applied for all businesses within a sector. They applied for all people in a certain region. So now when we look at the restart and the fight phase, this can happen very differently, because in the meantime, healthcare capacity has often been ramped up, the right infrastructure and reporting schemes have been put in place, and now is the time to act in a very different way. So instead of acting on a full national level, the opening quite often happens in a regionally differentiated manner, because different regions might be at different stage of the outbreak. Instead of being preemptive, they are much more parameter-based. So we can look at the specific situation in specific industries, how vulnerable are specific population groups, and how well prepared are certain regions. And they don't have to be generic anymore, but they are risk-based. As I said before, we can now look at certain establishments, so we can look at certain regions, and we can look at their risk profile. And by differentiating it by groups, by areas, and by regions, right, we also have the opportunity, country by country, but also globally, to learn from each other, to see what happens if we loosen certain restrictions, right? What do we have to expect when schools open again? Right? And this is very important to learn from these steps by step and do it in a differentiated way, parameter-based, risk-based, and compared to the way how the lockdown was introduced. So if we now go 2 pages down to page 6. We can see, and I won't stay long on this one, we can see that many countries are either already entering or are just about to enter the restart phase. And they do that in very different ways, and we'll come later on to that. They do that in different approaches. And the next page shows us the 3 main approaches that are visible. There are those countries, if you flip to the next page, there are those countries which go for a full reboot. Right? So they potentially have a very strict border control. They go down with the lockdown to a full containment, and then they open the society in a walled or in a fenced way. Right? So they prevent heavily imported infections and open very quickly the national and the domestic economy again. Then there are approaches to protect the vulnerable and to take particular care of the elderly population or people with a precondition in order to open up the economy much faster for the groups that are not that much at risk. But the most common approach that we see is a graduated approach, where, as I said before, either by region, by industry, by entity size or type of entity, restrictions are lifted, certain protocols are adhered to in order to make sure that we have the outbreak as much under control as possible, and that is quite often supported by intensive testing and tracing of new infections. And one country that went through this process already, and as I said before, is further down the road, is China. And I'm happy to hear and share with you what Yvonne from our Beijing office can share with us about the situation in China. Yvonne, over to you.
Thank you, Alex. Can we move to the next slide? So China is what Alex has described as a full boot model. So China's lockdown happened very early on January 23rd. And then within the course of 2 months of containment phase, all the cases outside Wuhan, first of all the cases in China, not 80% of those were limited to Wuhan. So there was a very limited spread outside Wuhan and the Hubei province. So, and then within 11 weeks, the cases in Wuhan also dropped to 0. So right now, local cases remain 0 or single digit. We have some imported cases, but there are quite strict border control. So this was the story of containment. The lockdown was very effective. If we see the number 10 days after Wuhan lockdown, the numbers outside Wuhan start to drop in rest of the China. And 3 weeks, it start drop quite sharply in Wuhan after they introduced the diagnosis all, treat all, and collect all policy. The restart actually started very early. I would say China's restart has been, we think, 5 phases. And it's a very gradual process over the last 2.5 months. The first one was actually right after the Wuhan lockdown. Lockdown happened right before Chinese New Year, where most companies and factories were closed and migrant workers went back to their hometown. So immediately after the lockdown, there is a calling back of all the workers to resume production on key medical supply, the mask production, medical clothing production, ambulance. There is a lot of flexible manufacturing. China didn't have enough capacity at that time, so some of the car manufacturers switched their production line into masks. Some of the clothing manufacturers switched their production line into the production gear, medical clothing. So there was a full mobilization in the first phase. And then when the Chinese New Year holiday finished, I think most of the BCG clients, and in the number we see about 60% of the enterprise actually resumed operation, but mostly in the remote working model because people were isolated at home. In the same time, there is 100% guarantee, supply guarantee on all the medicine, energies, transportation, retail, logistic, food. So all of those industries are required to operate at above 100% capacity to compensate for some of the lockdown area. And then we have seen a lot of support went into Wuhan and Hubei provinces. So this is what we actually see in the first month of the lockdown. And then we see the third phase started 4 weeks after the initial lockdown. We start to see the number dropping really fast outside Hubei. And there is a national guideline issued on manufacturing or low-medium transmission risk business to reopen. There was a very detailed guideline on what are the sanitary measurements, what are the checking points, what are the distance, minimum 1.5 meters distance required, how should the cafeteria be run, how should worker be protected. Only companies that can provide the required protection to the workers are allowed to open, and there is a pretty detailed list. And we start to see most of the manufacturing, construction, trade, commercial services, and some of the retail actually went back at week 4. On week 5 of the initial lockdown, outside Wuhan, a lot of cities and provinces, local cases have dropped to, new cases dropped to 0. Then there is a lot of initiative being taken at the local level. So this restart phase is not only gradual, it's also quite bottom up. The national government only issue the guideline, but the local cities and provinces will decide they will open fully, or they will have the code of green code, and different provinces will recognize each other's green code. Green code means they don't have any new diagnostic cases for 2 weeks. Then we start to see people flowing, and people start to move among those green code provinces. And that is quite a bottom-up approach. And the last phase is what we are in now. That's 11 weeks after the initial lockdown. And in Wuhan, the new diagnosis cases become 0 and has been 0 for the last few weeks. And Wuhan reopened at week 11 of lockdown. And we also start to see services industry, restaurant, hotels, education, school reopened, nursing home, farmer market. So these are the 5 different phases we've seen. I would say the good news is, although China is probably now 80-90% back to normal, we haven't seen any rebound of the COVID-19 cases in China. There were, for a period, there were a lot of imported cases, up to 100 a day, but all of those were put into quarantine. So they haven't caused major local spread. So that's very good news, because people was worried that when we restart the economy, there might be a second wave. And so far, it looks in the last 2.5 months, with the gradual opening process, it can be controlled. Next page. So this is what is China activity up until last week. China's main energy resource for manufacturing is coal. So the coal consumption usually is a pretty accurate indicator of China's manufacturing activity. It is up to last week back 89% as the same period last year. The property transaction, which you see a huge drop during the COVID-19, is back 77%. Unfortunately, the congestion in Beijing and in major cities is also back. It starts to see very crowded road. Although metro people, the government is still controlling the number of people who can enter the metro station, ensure the safer social distancing measure. So the metro is still 60% with control. And if we look at the next page, this is overall China's GDP. It was posted a couple of days ago. Actually, I think Hubei also posted. Hubei in the first quarter, the GDP was down, I think, 36%. But overall, China GDP was down 6.8%. So that was quite a major drop. It was unprecedented in China in the last 30 years. But the good news is the March number looks much better than the January and February. So you can see a pretty clear recovery path on the way. I would also add that the recovery is pretty uneven. Much of the manufacturing has been back quite early on, as we've shown in the previous page. But some of the services are still in a gradual process. Probably a lot of the services is still only back 50%. This is definitely longer than what we have expected in February. In February, when China took very strict containment measurement, we are expecting full recovery in April and full opening in April. But because the spread in the world, now China is expecting a much longer mitigation phase. It's probably up to 18 months to 24 months until we as a human race could eradicate the virus from our world. I don't think any country can stand safe by itself. So there will still be border control, strict border check. There are still some social distancing measurement in place, and there are very extensive testing. They just announced 2 days ago. So this is a new phase for China. Maybe two more messages. Let me highlight the changes. I think one biggest change during the COVID-19 is actually the digital. Everything happened digitally because people were isolating at home. Digital school, digital office, digital some of the digital manufacturing. So all of my clients, I lead our industrial goods practice and public sector in China. All of the clients are thinking about transforming digitally. First, start with digital sales and marketing. We have seen some phenomenal success of car manufacturers or housing developers selling very expensive house online or selling cars online. So people now really want to move with digital and then transform digitally. So we will see a quite big rise of industrial internet in China, especially the Chinese government rescue package is very different than the US. China is not handing out cash, but instead China is going to invest in infrastructure and new infrastructure, including 5G, data center, etc. So I think this will be the most significant change we will see. Consumer would have changed quite fundamentally, and this change will likely to stay. And we will see this new wave of the change with the industrial companies as well. The last thing I want to mention is resilience. I think Vincent talked about that. So most of Chinese, we work a lot with the city's government and provincial government in China. If we look back in the last 100 years, you will see there is a pandemic and epidemic used to be every 30 years or 40 years. But in the last 30 years, there has been one every 7 or 8 years. So with this COVID-19 as well, many of the government are reflecting on how to build a more resilient city, a resilient country, or resilient world. including the levers in healthcare, more robust healthcare system, more robust warning system, more resilient economic structure, more resilient society structure, and how to use digital as a key enabler, and how do you actually reform governance to be more effective. So those are some of the projects we are actually working on. That's it for me for the sharing on China. Happy to answer questions later, but I'll hand back to Alex now.
Okay. Thank you, Yvonne, for those interesting insights from China. If you stay on this page for a little bit, right, and as we enter the restart, as you said before, right, governments have to look at different angles of how prepared, how ready they are for the restart and for the longer fight phase. And of course, like during the lockdown, everyone was very, very focused on the healthcare readiness, and this continues to be an important element. Of course, we have to look at the indicators like the virus growth, the spread out, the readiness of the system in terms of ICU capacity, healthcare staff capacity, but also protective equipment, PPE, are important, and that are the base parameters. Now that we are entering the restart, additional things become more and more important, right? For example, the testing capacity and the testing approach. There's a big question between how much do we test and who do we test, right? Many countries followed, because of limited test capacity initially, rather testing of the symptomatic cases, right? Not knowing because of that, what is the dark number of people who have asymptomatic cause of the disease, right, and don't show any symptoms. That's important to know because they are still spreading the virus, and they contribute later on to the group that is immune against the virus. So that's very important. So test regimes test capacity is ramped up, and test regimes and approaches are changed. And secondly, also what was just mentioned by Yvonne, the tracing capacity and the tracing approaches, and I'll come to that in a second again. Tracing and isolation of cutting of infection chains becomes super important when we want to open economies. That is a healthcare readiness, but there are also two other perspectives that should not be forgotten. We spoke about the business readiness already, and that are things like are businesses ready and able to split their staff, for example, in A, B, and C teams, which work isolated from each other without contact. Do they introduce shifts, or do they switch more towards digital processes, so with less contact between customers or even employees? And so that's the business preparedness. And then finally, the public response. And the public response was very important, of course, during the lockdown phase. But during the lockdown phase, as the term says, right, individuals and citizens are typically in their home, in their apartments, so there is, by definition, there's interaction. Now, when economies are opening, it is super important to make sure that the public response and behavior follows the guidelines and the hygiene standards. So, are they compliant with, for example, wearing masks when the government mandates that? Do they keep the right distance? Do they apply the right hygiene standards? And do they, for example, comply with quarantine measures and regulations, or do they participate in tracing and allow early cutoff of infection chains? Right? And one big topic that is being discussed in many countries is the digital tracing of infection chains. And the traditional approach of doing interviews is very time-consuming and quite often not comprehensive enough, because you only can list those people who had exposure to you when you later on find out that someone was positively tested, right? This person typically only remembered the people they consciously interacted with, but the people who were sitting in the bus or train next to them or in the supermarket, it's difficult to identify those and to cut off infection chains there. Therefore, many countries think about digital solutions, and let's quickly look at that on the next page. We have, for example, here from Singapore, the Trace Together but very similar approaches
Alex,
are
we have
implemented.
2 minutes to allow question and answer after this, so you can.
Okay, so then I'll do that, and one more part very quickly. Thank you for the heads up. So there are these tracing apps, right, which protect privacy as much as possible and allow later on a follow-up of the infection chain. So what's super important here is to have the right penetration and adoption rate, right? So 50–60% in many countries is seen as the minimum, and that's a very challenging adoption rate already across your population in order to have a meaningful result and benefit from these apps. The second thing that I quickly would like to highlight in respect of the time, if we go to the next page, is something that I referred to in the very beginning already, right? So now many countries can take advantage of their structures, their governance structures, and their regional and local levels, authorities that they have in place, right? While the national level quite often is a level that establishes the risk levels, the guidelines, gathers intelligence, and shares experiences, right? The decisions for the opening are quite often taken on a regional or even local level, where the regions establish the oversight, they establish a control tower, they take decisions depending on the readiness of the region, and then these policies are implemented on a local level and are also enforced on a local level. So this interplay between national level, regional, and local level is very important. And as we referred to before, this is now also the time to heavily engage actually the private sector and they have to take their responsibility, and they can also contribute either through solutions or by preparing their own businesses, right, for the opening by all the measures that we mentioned before. So a much more complex ecosystem of actors which have to cooperate in a well-informed manner together than we saw during the lockdown, where it was very often just a top-down approach to flatten the curve very, very quickly. I will cut here because of in order to make enough time for Q&A. I think we have another roughly 10 minutes. Welcome everyone to share his or her questions. I think that happens through the chat, right?
Yeah, thank you, Alex, and the BCG team for a very insightful presentation. If I may, I have two questions. One is for Alex in terms of, you mentioned there are other sides of the pandemic that should not be forgotten. And I would like to highlight one dimension of this, which is the soft side, the psychological challenge as we restart the economies or the mental set. So we've seen countries in lockdown for at least a month and with consistent messaging on social distancing and so on. How do you see the society coping up with coming back, and what is the psychological challenges that you might think of? And Yvonne, if I may ask the second question for Yvonne, and then I'll leave it for both. We've seen the difficulties in collecting data, especially in countries where the testing infrastructure is weak, or the availability of the testing equipment is not readily available, especially in developing countries. How reliable the data that we see in this presentation? We've seen many countries revise their data upward in terms of the number of cases. So, Alex, to you.
Thank you. Yeah. So let me take care of the first one. You mentioned a very important element, the social element, and indeed we can witness very challenging situations in many countries, right? Where in particular people who will potentially live alone or in limited space, right? For them, the situation of a lockdown is particularly stressful, right? During massive curve phase, not being able to go outside, not being able to interact with other friends and family, right? It's a very demanding situation. The situation now for many people gets much easier as the restrictions are limited, but there are groups which will continue voluntarily to stay very much in isolation, and that are the elderly people, that are people with risk prevalence. So there are groups of the population which will continue to live in anxiety potentially, and it's very important to activate mechanisms and initiatives. Like in many countries, there are neighborhood initiatives being initiated and supported by the government through platforms in order to make sure that we don't forget about these vulnerable groups and integrate them properly and take care of them. So it's a very important and a very challenging task indeed. Yvonne, you want to talk about the second one?
Yeah, sure. Without testing, there will be no confirmed numbers, right? So I think if I use China as example, at the very beginning in Wuhan, I think there is a serious underreporting because nobody knows what virus this is. And then once the virus was identified as a new virus, and there are some testing done, but there are still people who stay at home, and this is an extremely sneaky virus. We also found out there are people who carry the virus without showing any symptom. So what happened in Wuhan in week 2 is after lockdown of the week, 2 weeks into lockdown, the number was not dropping. It hadn't reached peak. Then they changed the strategy in Wuhan from treating the sick by they have this policy called treat all, diagnosis all, collect all. And you probably have read the news that Wuhan built 2,000-bed hospital within 10 days. But besides that, they also built 16 makeshift hospitals. And then they start to put everyone who have mild symptoms, not isolated at home, but into this centralized hospital. So that I think that was very, very effective. They also went around every household to test, to screen through some of the potential sick people. I think that was truly the turning point in Wuhan. It's only when you start to test everyone and find out anyone with symptom or without symptom and have them quarantined or centrally treated in the hospital that you can really cut the trace line. And so far, I think the number is very accurate. If I go out, actually outside of Wuhan, I think the number is very accurate. The whole period, the last 3 months, if I want to go out, in Beijing have 30 million people, but we only have 400 confirmed cases. Still, we have been put under very strict quarantine, lockdown. And if you go out to any buildings, even now, we haven't had many cases for a long time. I probably get tested 6 or 7 times. Every time I leave a building, get into store, go into office, I get tested. So I think this is probably going to remain for quite a long time because there's always a risk of imported cases. But this constant, extensive testing one way to make sure that you won't have a second wave.
Okay. Thank you. We have 5 minutes left, so I think we have enough time for one intervention that was asked before the panel starts. So Dr. Rima Al-Bunayyan, the CEO of the Center Value of Improving Healthcare. If you can unmute.
Thank you very much. Thank you for the opportunity to intervene with this important webinar by the T20. And I'd like to link some of the work we're doing with the discussion, the very interesting discussion that we heard today. So the Center for Improving Value in Health is an independent center, national independent center in the kingdom that exists to enable continuous improvement in value in health by several ways. And it does this through some of what we heard in our discussions today, sharing knowledge, advising in evidence-based policy, and improving capacity and understanding of improving value in health. And in itself, this is the direction that health systems have started to go into. And the experience of health systems in all sectors of going through the COVID-19 pandemic has truly demonstrated the complexity of health systems and the complexity of interaction of measures that are taken by health systems towards desired outcomes or desired and the most meaningful possible outcomes in the health of individuals. And we heard the comment on mental health and well-being of people. We heard a lot about learning from each other. We heard a lot today about the use of digital health. And in the work that we did in the center, we produced a piece that, I'm wondering if Laura can share that on the screen. We produced a piece that looked at health systems' response to the pandemic and did kind of a comparison of the interventions that countries have taken. And I won't take too much time, but I'll just touch on a high level of some of that. So there are a number of measures that were taken, and these measures were taken at different times in different countries that resulted in various outcomes. In addition, the repurposing or the way health systems have addressed their own resources, whether, we heard about makeshift hospitals, we heard about how health systems have redirected elective procedures and redesigned how the work is being done. In addition to all of this, a number of welcome things came, such as innovations that are to address the COVID-19 pandemic that will likely last with us. An example from the Kingdom of Saudi Arabia is the utilization of an app that people can go in voluntarily, and they're encouraged to interact with the system on a daily basis to check their risks. And movements towards digital solutions. We heard from the Chinese experience. Telehealth is something that we in the healthcare sector have been waiting to upscale. And now that it's on the ground, we predict that these solutions will last with us for a long time. And the link to this paper will be provided by the host of the call for readers or the participants to take a more in-depth look at. And we will be producing another piece that will more focus on the value perspective in health systems. And I thank you.
Thank you, Dr. Reem. We are at 1:59 at the end of our webinar. There are a lot of very interesting questions in the chat, and we will take these questions and incorporate them into our agenda for the new task force 11 on the pandemic, as we announced it. And as mentioned earlier, we will be holding the webinar on May 5th to officially launch this task force to cover areas of the social side, the economic side, the financial, and the environmental impact on the pandemic. And there will be a number of questions on the environmental impact. Unfortunately, we don't have time to cover them, but on May 5th, we will have one full day for the task force. Let me again thank the co-host, our National Development Program, and also BCG. And also, I would like to extend a thank to our speakers, Dr. Nahar and the BCG team for the valuable information that they shared with us. Thank you all for attending. We really do appreciate your interest in this very important topic, and have a great day.
Thank you very much. Thank you, Dr.
Thank you.
Thank you.